Hello, friends. Uh, Radicular pain is one of the most common presentations that can be seen when we talk about leg or arm pain. And at this point of time, when we are in the midst of a COVID crisis, you might be thinking, how is that relevant? But there are evidence and there are studies to actually show that when the last epidemic of the SARS virus happened, the number of patients with back pain and neck pain tripled in the following months after the epidemic. So actually, when we are past the peak, we are going to be seeing a huge number of increase in neck and back pain. And therefore, it becomes very important to understand actually when is it a radicular pain that has a clearly defined mechanism and a defined set of treatments that have shown to be successful and for which guidelines are there, and when is it important to actually look at the whole person. My name is Dr. Deepak Ravindran. I'm a consultant in pain medicine at the Royal Berkshire Hospital in Reading. I'm also the lead pain consultant for the award-winning integrated pain and spinal services in the NHS in Berkshire. And I'm going to be holding a webinar, which has been very kindly organized by Oryon Develop for extended scope practitioners, for physiotherapists, for osteopaths, for chiropractors, for massage therapists. And this is going to be on the 19th of May from 7 in the evening. Join me to understand the latest treatments on radiculopathy, radicular pain, its mechanisms, its management. I'll be going through the latest NICE guidelines that have come through a couple of years ago. I'll also be highlighting certain new advances in pain management itself and how we need to be a more holistic approach. While there would be very defined treatments for radicular pain, it's important to envelop this in a broader plan that includes and looks after the patient. And in this time around the COVID crisis and the pandemic and the months after, the well-being of the patient is as important as just doing one treatment or one injection or one medication. It's important to know when to do it, in what order to do it, and how to do it. So I look forward to seeing you on the 19th of May. Thank you.